In a bid to enhance uptake of the COVID-19 vaccine in the country, Kenyans are now being advised to ignore notions that certain jabs are more effective than others.
In where we still remain even unpredictable on the number of doses and when they come, and you keep saying, I'm going to wait until Johnson comes. And I know that is happening in Kenya. You may wait until you find yourself on oxygen. If you choose, you may actually die.
Despite recently hinting that mix and match may be practiced in Kenya, the ministry has warned Kenyans against waiting on a particular type of vaccine for their second dose.
If there are any side effects, if there's any fatality, and we have not come up with a procedure to know how, after the two, which was responsible for which, what are we going to say caused that fatality or very severe disease?
The Ministry of Health is concerned that unvaccinated persons are the main drivers of the current surge in COVID-19 fatalities, particularly among the aged.
There's a big misconception. People think if you have diabetes, hypertension, or cancer, then you should not get the jab. You need it more than anybody else.
90% of those deaths are in people who are more than 50 years and above. They form 2.6 million of our population, but only 9.1% of that population has been fully vaccinated.
This is a situation that health workers continue to grapple with at health facilities, with the Ministry of Health Acting Director General Dr. Patrick Amoth noting that Kenya is currently at the peak of the COVID-19 fourth wave.
The total number of people on oxygen stands close to 1,000, so the demand for oxygen is quite high.
As the country continues to receive COVID-19 vaccines, the government, on the other hand, is in the process of revising its deployment plan in an effort to ensure vaccine equity.
We looked at Johnson & Johnson to be like our primary vaccine. It is the easiest to administer. We would prefer the lower facilities to be the ones that will be prioritized for Johnson & Johnson.
Following the approval of the Pfizer vaccine by the Food and Drug Administration for marketing and inoculation among teenagers above the age of 16, this opens a possibility for the same to be implemented in Kenya, with over 1.7 million doses of the vaccines expected in September this year. However, vaccine hesitancy is still a challenge facing the government.
Vaccination is the main role of counties. They need to ensure that there is increased access through vaccination posts and trying to reach the mobile population.
Ben Kerera, K24, Nairobi.